Ladies or women, are you experiencing a vaginal bleeding after sexual intercourse, in between periods or after menstruation? Kama umeenda mechi na mtu yako pale, then after sexual intercourse unaona tone za damu, ama in between periods kama unanyesha date 1, 2, 3 of the month, ikifika date 10, 11, 12 tena unaona tone za damu, ama after menopause kama umemaliza kuzaa uone tena tone za damu. Are you experiencing vaginal discharge ambayo it's not normal, ambayo iko na full smell? Are you experiencing what we call menstrual bleeding which is heavy and that lasts longer? Kama kawaida unanyesha siku 3, unapata sasa unanyesha siku 6 ama 5. Yeah? Are you having what we call dysuria, that is painful micturition, ama unapoenda haja ndogo pale unasikia uchungu kikojoa? Are you having what we call a dull back pain, ama uchungu hapa nyuma kwa mgongo, a dull back pain? Are you having what we call leg swelling? Yeah? So hope you are doing fine. Welcome to our YouTube channel. This is your channel and I'm welcoming you to the second episode of the cancer series. Hope guys you'll enjoy. Now, at some point you've heard about cervical cancer. Maybe you have been diagnosed of cervical cancer, or maybe you know friends or relatives who have been diagnosed of cervical cancer. Cervical cancer pia tunaita ni saratani ya shingo ya uzazi ama saratani ya njia ya uzazi. So what is cervical cancer ama cervical cancer? Cervical cancer, this is the creation or growth of abnormal cells in your cervix. Ama tunaweza sema ni zile cells ambazo zimekuwa abnormal kwenye cervix yako na zimegrow uncontrollably and causing what we call a carcinoma in your cervix. We've said cervical cancer begins or starts in the cervix. Cervix, this is the lower part of your uterus, which connects the vagina. So ni kumaanisha kwamba cervix iko hapa tu chini, ama where the baby grows. Unaweza sema is where the baby grows, hapa chini, the part that connects your vagina. Sawa sawa? So the big question is, what causes cervical cancer? Ama nini haswa inasababisha saratani ya shingo ya uzazi ama njia ya uzazi? Now, cervical cancer is caused by human papilloma virus, or you can just call it the HPV. This is a virus that is sexually transmitted. So it is a sexually transmitted infection that affects the sexually active individuals. Yeah? So HPV is a virus and it's acquired sexually. So once you've acquired this HPV inaweza kupatia ugonjwa kama vile papillomas or warts. And warts, these are the sore-like bumps around your vagina or the vulva. These are the sore-like bumps around your vagina or vulva. So some groups of the HPV, that is group 16 and 18, sasa hizi ndio ziko associated with cancer. HPV group 16 and 18, these are the groups of HPV which causes cervical cancer. Yeah? So HPV, it is usually asymptomatic and it can stay in your body for a long duration of time. So once umepata hii HPV ama hiyo virus, it is asymptomatic. It does not display those symptoms. Yani unaweza kaa nayo bila kuonyesha dalili ama bila kuonyesha hizo ishara. So kumaanisha hata ukipata the HPV today, you might not know. But if you are battling some STDs and STIs such as gonorrhea, syphilis, talk of herpes simplex, talk about HIV, then you are at a greater risk of getting HPV. Yeah? So if you are battling some other infectious diseases, tuseme sasa uko na gonorrhea, uko na syphilis, then the chances of you getting this virus or the HPV are increased, ama ziko juu. Yeah? Because kwa kawaida, the body has got its immune system. Now, once you've contracted the HPV, the system or your body can eliminate HPV on its own. But now when your immune system is compromised, ama wakati immune system yako ama kinga ya mwili wako iko chini, then itakuwa vigumu sana for it to fight the HPV. Hence the HPV itapata nafasi mzuri ya kupenya na ikupatie hii madhara ambayo tumesema ni saratani ya shingo ya uzazi. Yeah? So if you've acquired HPV tuseme umefanya the sexual intercourse na umepata HPV, this virus will move all the way to your cervix, and then itaingia kwa hizi cells za cervix. It will adhere to the cells of the cervix, it will gain access into the cells of the cervix, and after it has entered into the cell, itavuruga zile tulisema ni DNA katika ile seli. And if you are very keen enough on my first episode, tulielezea vile hii ugonjwa inasababisha mutation katika ile seli. So HPV will cause a mutation in the cell of the cervix. Na ikishavuruga DNA kwenye zile seli, now these cells will begin replicating or dividing uncontrollably, hence causing what we call a carcinoma or causing abnormal cells around your cervix. Yeah? So that is how cervical cancer or cervical cancer comes to be. HPV goes to the cells of the cervix, it destroys the DNA and interferes with the genes or the mutation of the cells, and then now these cells will begin replicating and dividing uncontrollably, hence causing what we call the cervical cancer. Yeah? So I know you've got lots of questions about HPV. You've got lots of questions about HPV, but the good thing is that HPV is preventable. One, we've got what we call the HPV vaccine, which is given to children or teens of age 9 to 14 years. Na hii vaccine ambayo inadungwa hawa watoto wenye umri wa miaka 9 hadi 14 ni kuwasaidie so that they cannot contract this virus. Kwa sababu tumesema HPV is the causative agent of cervical cancer. Yeah? So 2 is reducing the number of sex partners. Kama wewe kwa kikawaida huwa unafanya mechi na watu 2, 3 ama zaidi ya 4, so it's wise for you to reduce the number of your sex partners, which might be difficult, but I think some people prefer buying a packet of milk rather than buying a cow. Then if you are one of those types of people who prefer or like buying a packet of milk rather than buying a cow, then 3, consider condomizing. Yeah? Ukishavaa seed yako pale, then the chances of you contracting ama getting the HPV are very minimal. They are very low. Yeah? So if you are experiencing the symptoms that we've talked about when we are starting this episode, if you're experiencing a vaginal discharge which is not normal, if you're experiencing vaginal bleeding in between periods and maybe after an intercourse, having painful micturition, if you're having pain while having sexual intercourse, if you're having what we call a dull back pain, then kindly consider visiting or seeing your gynecologist for further examination. Your gynecologist will recommend some 2 tests done to you. Those are the screening tests. We've got the pap test or the pap smear, and then we've got the HPV screening tests. Na HPV screening test tuko na test 2 ambazo zinafanywa sana. We've got what we call the DNA probe for HPV. Then we've got what we call the PCR for HPV. Yeah? And then now we have got what we call the pap smear or the pap test, ambayo inaangalia kama kuna any abnormality in the cells of your cervix. I know maybe you were wondering how we get the specimen or how we get the sample from your cervix. Yeah? Kwa sababu lazima tupate specimen from your cervix so that we can process or we can continue with these 2 tests ama screening tests. Yeah? So without causing any pain to the walls of your vagina, without causing little discomfort, with causing little discomfort, we are going to show you how we are going to obtain our specimen from your cervix so that we can continue processing and seeing if you've got the carcinoma in your cervix or you are healthy. So guys, kindly like, follow, subscribe, share, and every Tuesday I'm dropping an episode of the cancer series. Hope guys you'll be there, support us. Now this is not my channel, this is your channel. Thank you so much.